The affected area stops working when paralyzed. Paralysis can affect one part or all of the body. Muscle function is hindered due to injury or disease affecting the supply of nerves, and in the previous video, we talked about the symptoms, types, and prevention of paralysis. In today's video, let's know Ayurvedic medicine and treatment for paralysis. So, friends, watch the video till the last, and if you are new on my channel then subscribe now and keep getting such updates. Let's know paralysis from the point of view of Ayurveda. In Ayurveda, paralysis is called Panchakarma. When the Vata dosha increases or becomes imbalanced, it damages the sensory, feeling, and motor, moving, functions of the parts of the body called Ardhangvata. Paralysis is classified as a disease that arises due to an imbalance in Vata dosha. When this disease affects one organ, hand or foot, it is called Ekang Vata. When this disease affects both hands and feet, it is known as Sarving Vata. Vaksunga, difficulty speaking, and Ardita, paralysis on the face, can be associated with Pakshagat. According to Ayurveda, to control paralysis, it is necessary for a long time, 3 to 4 months, to snena, lubrication, swedana, sudation steam bath, basti, medicated enema, shiro basti, pouring oil on the head, purgation, etc. In Ayurveda, some symptoms occur before the Pakshagata, which can be prevented from taking the form of paralysis if it is identified on time and treatment is started. 1. Mata, get confused or become insensitive due to consumption of any kind of medicine or substance. 2. Murkha, fainting due to CVA, cerebrovascular accident or stroke. Sannyasa, coma due to an injury or CVA. Due to paralysis, there is numbness and pain in the affected part of the body, decreased motor function, working and coordination of hands, legs and other large parts of the body, excessive salivation and watery eyes, motion-related disorders such as walking difficulty and difficulty speaking, especially when paralysis is on the right side of the body. Ayurvedic treatment of paralysis. Panchakarma treatment. 1. Sanena oleation. Therapy. In this treatment, a medicinal oil is applied to the body for 3 to 7 days. As a general treatment and to control paralysis for a long time, external and internal oleation is done. Some medicinal oils such as Mahanarayana oil, Dashamul oil, and Mahamish oil are used in external oleation therapy for the paralyzed patient. Oleation is used both in Shamna, mitigation, and Shodhana, refinement, for paralysis. It is usually recommended Saneha Panna, to drink oil or ghee along with external sanena. The effect of sanena therapy is increased by oleation through the internal as well as external use. 2. Swedana therapy. This treatment is recommended to control long-term paralysis and as a general treatment. It can also be given as a part of Shodhana, purification, therapy. Snena and swedana are done before purgation. In this, a person suffering from paralysis is treated with Upnaha Sweda, applying hot medicine plaster on the affected area. If a person is paralyzed due to a Vata imbalance with Kapha dosha and feels symptoms like stiffness, stinging pain, seizures, swelling and stinging or chills on the skin, then in this condition, Tapa, fomentation, fluid, liquid, heat, steam, and Upana Sveda. 3. Maridu Varakna, mild purgation. Virechna is recommended as a major treatment of paralysis. And this typically includes Shodhana therapy. To control paralysis, Snigata Virechana, oily purgation, consists of plain or processed castor oil alone or with milk, after which the person purgates. Mishrana Sneh, herbs in ghee, is also useful in purgation. The Virechana therapy should be done only with Sansarjana Karma, 7 days balanced diet. People of Vata nature, especially those who suffer from constipation, are brought Virechana with castor oil, castor haritaki pak, senna. 4. Basti Karma. 4. Basti Karma is useful in the treatment of diseases caused by aggravation or imbalance of Vata. It cleans the intestine completely. In this therapy, ama, toxic substances, is taken out of the body through feces. After this, the intestine is able to function properly. For all types of paralysis, giving Narua Basti, enema of medicinal decoction, at the appropriate time is beneficial. Arandmul basti, basti with castor root and other herbs, Matatellica basti, honey, sesame oil, lukewarm water, dill plant, and other ingredients, Siddha basti and Rajapan basti, honey, milk, ghee and other nutritious substances. Say basti is used in Nira basti. Narua basti includes Shodhana therapy and is recommended based on the condition of the paralysis and the lifestyle of the patient. To control paralysis for a long time, Shiro basti is done with murta oil, applying oil on the head. Different medicines are given in the form of decoction, oil, milk, buttermilk or water through Shiro basti. 5. Nisaya. Karma. Oil or extract, juice of the leaves of the chosen medicine, is put into the nose under the practice of Nisaya karma. If a person is recently paralyzed, then Nisaya therapy is useful for him. Vata-predominant stages such as Ardita, Murka, Mata and Shandabindu oil play an important role in the treatment of the item. Pradhamana Nisaya is a purification therapy in which paralysis caused by kapha and the powder of vacha, Acorus calamus, and catfall, Miraca nagi, is used. It is beneficial for an insane person, in case of a brain injury or a person who has gone into a coma. Now, let's discuss about paralysis Ayurvedic medicine and herbs. Ayurvedic herbs for paralysis. 1. Ashwagandha. Withania somnifera. Ashwagandha is an immunity-enhancing herb that heals the tissues and helps in the treatment of decreased muscle strength, loss of energy, fatigue, inflammation, skin diseases and paralysis. It has neurogenerative, anti-inflammatory, anti-stress, muscle-building and nutritional properties. Ashwagandha is available in various forms such as decoction, and powder which is used by mixing in oil or ghee. You can take ashwagandha powder with hot water, milk or honey or as prescribed by your doctor. 2. Bala. Sita cordifolia. Bala strengthens the body and heart. It gives strength to muscles and tissues. Therefore, it works by removing the weakness of a paralyzed person. It especially helps in strengthening the body and creating new nerve cells. Bala also relieves nerve pain, numbness, joint-related diseases, wounds, tumors, muscle spasms, and ulcers. Bala is available in the form of medicinal oil, decoction and powder. You can take Balas powder with oil, hot water or honey or as prescribed by your doctor. 3. Nirgundi. Vitex Nagundo. Nirgundi helps in reducing inflammation and irritation in joints and muscles and relieves sprains in hands or feet and headaches. It is recommended to apply Nirgundi oil to a person suffering from paralysis. The fruit of Nirgundi is especially available in powder form, which can be used as paste or decoction. Also, Nirgundi powder can be taken with honey or as advised by your doctor. 4. Shunti. Singiber officinale. Shunti, dry ginger, has many medicinal properties. It helps in treating indigestion, nausea, vomiting, sore throat and diarrhea. It relieves many health problems such as cramps, asthma, arthritis, and urinary incontinence. This also removes the problem of unconsciousness, being insensitive and speaking during unconsciousness. Therefore, Shunti is useful to bring back consciousness in a person suffering from paralysis. Shunti can be taken as extracts, pastes, fresh juices, powder or decoction. You can take Shunti churna with milk, hot water or honey or as advised by your doctor. 5. Rasna Placia lanceolata. Rasna contains lactones, flavonoids, and sterols that have anti-inflammatory, soft tissue soothing and spasm relieving and energetic properties. Because of this, Rasna is useful in treating diseases like paralysis. Rasna is mainly useful in the treatment of paralysis due to its Vatahara property. You can take the powder of Rasna with milk, hot water or honey or as advised by your doctor. Now let's discuss some Ayurvedic medicines for paralysis. 1. Dashmularishta. Dashmularishta is a mixture made from the root of 10 herbs, and includes pipali, chawal, turmeric, rasna, jatamansi, and musta. Dashmularishta enhances immunity and have the ability to resist change in the doshas. Therefore, a person with paralysis is given Dashmularishta to get strength and vigor. Dashmularishta is also available in the form of decoction, which is recommended to be taken on an empty stomach or as directed by your doctor. 2. Maharasnadi Kawatha. This drug mainly treats Vata-predominant diseases and conditions. It helps in the treatment of thin people with Vata nature. Since paralysis is a Vata-predominant condition, Maharasnadi Kvath helps in relieving it. This herbal mixture also has anti-tumor properties that cleanse ama and impurities from various nadis of the body. You can take Mahasanadi Kwatha on an empty stomach or as advised by your doctor. 3. Yograj Gugulu. Yograj Gugulu is a mixture of Gugulu, Pipali, Chitrak, cinnamon, Amalaka, Vibhataki, Shunti, and other herbs. You can take Yograj Gugulu pills with hot water or decoction or as advised by your doctor. Yograj Gugul has Vatahara properties and for this reason, it is effective in paralysis. Depending on the prakriti nature of the person and the affected doshas, the medical treatment is determined. Consult your nearby Ayurvedic doctors for proper medication and diagnosis of the disease. According to Ayurveda, what to do and what not to do after being affected with paralysis. First, let's discuss what to do. 1. Include ginger, garlic, radish, black gram, mung dal, onion, and petha in your daily diet. 2. Eat mangoes, pomegranates, and grapes. 3. Stay away from smoking. Now, let's discuss what not to do. 1. Do not eat pungent, salty and astringent things. 2. Do not consume cottage cheese, butter and milk-based, and fried things and sugary drinks. 3. Do not eat barley and peas. 4. Do not exercise too much and do not stay hungry for long. 5. Do not stop natural desires such as bowel movements and urination. 6. Don't drink alcohol. 7. No need to think more. 8. Avoid going through the heat to cold temperatures. 9. Stay away from anxiety, fear, and anger. Now, let's know, how beneficial is the Ayurvedic medicine of paralysis? A study was carried out to investigate the effect of Snehapana in the treatment of paralysis. In this study, it has been proved that Snehapana is effective in slowly recovering a person suffering from paralysis, and no harmful effects have been observed. Significant improvements in symptoms were also seen in another study done to identify the effect of Shiro Basti on paralyzed patients. In another study, the effect of Panchakarma in a paralytic patient were examined and found that Panchakarma therapy is much less likely to cure a paralytic patient completely, about 1%, but it is found to be effective in improving recovery from paralytic patients' medical condition and friends. This is also my personal experience that Panchakarma is very successful in healing paralysis. Let's know some side effects of Ayurvedic medicines for paralysis, if any. If the medicines are taken in right dosage and quantity and under the supervision of experienced doctors, no harmful effects are seen from taking Ayurvedic herbs and medicines. However, some people may suffer severe side effects of these drugs depending on the nature of the person and the condition of the disease. Some Ayurvedic medicines and therapies may have some harmful effects. 1. Persons with unbalanced pitta are not advised for Swedana karma. 2. Virachana should not be done in abdominal ulcers or gastric ulcers, ischemic heart disease, abdominal pain, ulcerative colitis, or physical weakness. 3. If there is a possibility of bleeding from the head of a person, then he should not give Pardamana nausea. 4. Ashwagandha should not be given in case of kapha in the nose or chest. 5. A person suffering from a serious disease like cancer can take ashwagandha in a quantity of 30 grams daily. 6. Shunti can increase the pitta dosha and can cause ulcers, irritation on the skin, fever, and diseases related to pitta. 8. If a person has a problem with congested chest, then he should not take bala. Other suggestions related to Ayurvedic treatment of paralysis. Ayurvedic treatment of paralysis helps to treat and control paralysis with herbs and medicines along with Basti, Virachana, Snehana, and Swedana. These also strengthen the body and balance ama toxins by removing ama from the body. Herbs and medicines improve the overall health of a person by eliminating weakness, which helps in controlling paralysis in the long run and also improves the quality of life. I hope you will like this information. Subscribe to the channel right now to get more updates like this.